Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Concentration effect, augmented inflow effect, second gas effect, and diffusion hypoxia or Fink effect. So all these include almost a similar effect, and these are seen mainly due to nitrous oxide. So whenever there is high concentration of nitrous oxide in the lungs, so high concentration of nitrous oxide in the lungs increases the uptake of nitrous oxide in the blood. So this will decrease the concentration of nitrous oxide in the lungs, because there is the nitrous oxide because of high concentration of nitrous oxide in the lungs, the nitrous oxide travels from lungs to the blood. So as a result, there is increased uptake of nitrous oxide in the blood, and there is decreased concentration of nitrous oxide in the lungs. So overall, there will be increased inflow of nitrous oxide from the machine is seen. Then, then because of increased inflow of nitrous oxide from the machine, this causes augmented inflow effect or concentration effect. In augmented inflow effect or concentration effect, there is increased flow of nitrous oxide from the machine to the lungs and from the lungs to the blood. So this is augmentation effect and augmentation inflow effect and concentration effect. So now, because of this, there is because of augmented inflow effect, there is increased concentration of the inhalational agent is seen, and as a result, there will be decreased oxygen. So this is called as second gas effect. Treatment of second gas effect is to decrease the inhaled concentration from the vaporizer. On recovery, we will stop the nitrous oxide from the machine. So there is decreased concentration in the lungs. So this causes increased flow from the blood into the lungs, thus replacing the oxygen. So now this increased flow from the blood into the lungs will replace the oxygen, causing diffusion hypoxia. So in this case, the patient will present with dyspnea and respiratory distress. So this diffusion hypoxia is also called as Fink effect. So the treatment of diffusion hypoxia is, here you should give 100% oxygen should be given for 10 minutes.
So, relating to the nitrous oxide, we have four effects. First and foremost, there is increased nitrous. First, there will be increased nitrous oxide concentration in the lungs. Now, because of this increased nitrous oxide concentration in the lungs, so this nitrous oxide concentration is more than that of blood. So, as a result, this nitrous oxide will go to the blood. So now because the nitrous oxide has gone to the blood, the nitrous oxide concentration in the lungs will decrease now. Now, because the nitrous oxide concentration in the lungs is decreased, now from the anesthesia machine, the nitrous oxide will enter the lungs. When the nitrous oxide from the anesthesia machine enter the lungs, now again the concentration of nitrous oxide will increase. So this is called as augmented inflow effect, or because the concentration of nitrous oxide is increased, it is called as concentration effect. Now, because there is increased concentration of this inhalational agent is present, this is called as second gas effect. Now, because of this increased concentration of nitrous oxide, there will be, so this is second gas effect. After that, the nitrous oxide from the machine to the lungs is stopped. So because the nitrous oxide from the machine to the lungs is stopped, the concentration of nitrous oxide decreases in the lungs, but there is increased nitrous oxide is present in the blood. No, so because of this change in concentration, the nitrous oxide from the blood will enter the lungs now. Now, because of this decreased concentration, now the nitrous oxide from the blood will enter into the lungs, so the oxygen which is present in the lungs is replaced, so there will be decreased oxygen. Now this is called as diffusion hypoxia. For this diffusion hypoxia, the treatment of this diffusion hypoxia is we should give 100% oxygen in 10 minutes.
Thank you and thank you for watching.